Hi YouTube. Um, this is Lashonda and Shania. I know I keep changing my name. It was Lashonda and Baby, but since we have her name and I do announce her name, I want her name to be a part of my channel because she's so special. So it's Lashonda and Shania. Um, this is going to be a collage of many short videos put together for a whole video over the course of the next few days. I'm not planning on uploading my next video, which you all obviously will know, until week 26. And I'm telling you why, because I have a lot that's going to be going on between week 24 and week 26. So sorry for the wait. But yesterday was my birthday. Yay! I kind of had a rough start to my birthday. To start off, I brought in my birthday and labor delivery because I had a really bad headache that wouldn't go away. I mean, it was worse than any headache I've ever had. So I called the doctor's office. This was like about 11 p.m. And after the midwife called me back, and I explained to her my symptoms of my headache and everything, and she was like, "Well, I want you to go to labor delivery so we can monitor your blood pressure and do some blood work to make sure you're not having preeclampsia." So I went in, and of course my blood pressure was high. It was high to the point they wouldn't tell me what it was when I got there, but all I know is that they put me on my left side. They put a cold rag over my head. They laid me flat, which was very uncomfortable. And I had my blood pressure cuff on that would check my blood pressure about every 5 minutes or so. So blood work came back normal, but I have to do a 24-hour urine, which I'll be doing every month, every 2 weeks to every month now. And one weird thing was my blood pressure finally dropped about 3 hours after I got there. And I had sat up because it was so uncomfortable just laying flat, especially just on one side. So I sat up. And the nurse, which was really sweet, came in and she was like, your blood pressure was very low. And she said, you wouldn't guess what it is now. It was 167 over 97, just from sitting up and everything. So she was like, we need you to lay back down, so it could drop. So when my midwife came in and everything, I asked her about it, and she said basically sitting up, because of the extra blood flow in your body, sitting up can cause extra strain in your body because you have so much extra blood flow because of the pregnancy, that it can cause your blood pressure to fluctuate like that. But to me, going from 117 over 58 to 167 over 97 in a matter of minutes is a big jump. But she said everything was okay. So this video is going to be a baby buy video, of course, on my birthday. One thing I could think about doing was buying her stuff. So I want to show this off because it is going to my mom's house today. Now this came from one of my YouTube subscribers, and I love it. Her name is Heather Logan. It's correct. She's my YouTube subscriber and my Facebook friend, and she was so sweet, and I fell in love with this as soon as I opened it, and I really appreciate it. I really thank you. My boyfriend also fell in love with it. I couldn't wait for him to see it, and it's just so freaking adorable. Here it is. If you can see, it's a Calvin Klein dress. And it's so cute. And look at the little booty bumps. This is where her butt gonna be. It's so adorable. I love it. I thank you so very much. I thank you from the bottom of my heart. I really appreciate it. I know that I have some stuff that I have to send out first for my pregnant YouTube and Facebook friend, which I'll be doing that soon. But I want to get some more stuff first because I constantly find things that I want to buy, and I'm just like a big kid in the candy store when it comes to baby shopping. I can't help myself. This is a blanket that I brought her. You may have seen this blanket in my baby buy video. The other one you seen was the one that was white that had pink and blue stars, I think it was. So this one is the pink one with pink and silver stars. Because I didn't want the one, with cats. I bought her my baby socks. Ain't those cute? So cute. My mom is gonna flip because I keep buying her stuff. I also went to Once Upon a Child to buy her something. Ended up spending $20 and I got 10 onesies and a few outfits, and oh, I so adore them. And believe it or not, these were only $1 a piece, so I racked up on them. These cute little headbands. Today is spa day with me and my mom and one of my best friends. So we're going to and I had to get 2 of these because these are so cute. So I got 2 packs of these. And I'm taking this to my mom today. She's gonna be like, "Dee, stop buying this baby stuff." I can't help it, you know. And I guess it's just a part of me that's like, I'm just so addicted to buying her stuff. And then I don't want to pass up no sales. If I see sales on stuff that I know that she can wear, she would like, that would be pretty for when she comes home and when she starts to grow up, then I'm going to get it. I can't lie. I spend so much money on this little girl, and I just don't know. I just can't stop. I also have a lot, and I do mean a lot, of clothes from a friend of mine that she has a little girl, but her little girl is 1, so she gave me all of her clothes that she can no longer fit, and I have a lot of them. I would do a mobile video of her stuff because it's so much. I'm not going to be able to put it all in the video and make a small collage of videos to go together over time. This video is almost already 10 minutes, and the next video I'm going to be making will be after my appointment at A.I. DuPont Children's Hospital for her echocardiogram on the 8th of May. So it will be, my doctor's appointment is on Monday, so it will be her 24th week appointment, so my 6-month appointment, and my appointment at A.I. DuPont put together, all the information put together, and then it'll be my next ultrasound for maternal fetal medicine, which I go every 3 weeks now, and I will explain that a little bit more in a second, on the 19th. So my next video will be about my maternal fetal medicine, and that should be everything put together that you will see together. So about my maternal fetal medicine appointment that I had Monday, I'm gonna let you know I was upset, and I'm gonna let you know I was upset. I didn't get no pictures, not one at all, and I like to track my baby's growth through her ultrasounds. I love having her pictures, and I didn't get any, and that's the first thing everybody asks, where's my pictures? I didn't get any. The tech was not nice. She did not explain anything to me. She was very quiet. We had to actually ask if she was moving, even though we could clearly see she was moving. I mean, you try to get the tech to interact with us, and she was like, yeah, she's moving, or That was about all she got out of her mouth. Baby girl's measuring on point. Her head is measuring like a week ahead, so that's kind of scary. Her head's measuring 23 weeks in 6 days, and I was 23 weeks in 1 day, I think. So her head is measuring pretty big. um, Her weight was estimated to be 1 pound 4 ounces. She's now dropped from the 80 percentile to the 50 percentile, which they say is normal for them. But it's kind of scary to me because she started out so high on the end of the scale, and now she's dropped down to basically the normal end, but close to the lower end, because they said that they were checking the flow of my blood flow from my arteries to my placenta, and my blood flow turned out to be kind of high on both ends. And she said basically what that means is that it increases my percent of preeclampsia 10%. So I already had a 30% because I do have high blood pressure initially, and now it's up to 40%. And she said it also means that I have a 40% chance of having a smaller baby, which is kind of scary to hear when the doctor tells you that. So basically, she was like, anything as any bad headaches, that's why I called, because she said, if you have a headache that seems out of the ordinary, it's very bad. She said, call, try taking Tylenol, try laying down on your left side. If nothing's working, she said, call your midwife and they'll tell you what to do. And she did. They told me to go in. So, she gave me my little pouch. Yes, my little kick count, which I start Sunday. Since I turned over to 24 weeks, I have to do my kick count. She told me that if I don't get 10 kicks in 2 hours, then go to the emergency room and tell them my baby, to go to labor and delivery and tell them that my baby's not moving, to be monitored. So I'm so happy to be getting the kick count first ever. So excited. These little things are just so exciting to me. And that's basically about it. My baby girl is still facing my back. Basically, that means that once the ultrasound probe goes on, you see spine and feet and head. You see no profile, because I wanted to try to get a profile picture to try to see if they'll do a 3D ultrasound for me. But see, if I have the same tech that I have with this doctor, I see two maternal fetal medicine doctors. They're both sweet, and like I told the lady when she was scheduling me for my next appointments, it doesn't matter who I see. I don't have a preference, because basically their ultimate goal is to make sure I have a healthy baby and that I'm healthy in this pregnancy, and to keep me healthy and keep her healthy. That's all that matters to me. But if the same tech I had with my first ultrasound, my anatomy scan, if I have her, I know she'll do, the 3D scan. I know she'll give me pictures, or at least try. Hopefully this little stubborn little girl of mine will change and flip over and face my face front versus facing back. Posterior, I think it's called. But we'll see. So the reason why my appointments went from every 4 weeks to every 3 weeks is because she said, most patients we see don't have, or they suspect high blood pressure, but they don't. She said, you actually do have high blood pressure. So she said, you know what, we're going to pull you up to every 3 weeks, which is why my next ultrasound is on the 19th. She did call me after my appointment because she forgot to ask me about my metformin and my insulin resistance. So I told her, and I told her that my OB is trying to put me on insulin because my sugars are running higher than normal. And she said, to be honest, because I am insulin resistant, it will take a lot of insulin for my body to respond. So she said she don't think that would be good for me. She thinks that either moving me to 2,000 milligrams of metformin a day, or adding another glucose pill to my regimen of what I already take. I asked about the glucose tolerance test. She said there's no need to do that. She said because we could say your sugar so far out of whack it's going to make you sick. She said, we know you have problems, and she said basically I'm going to go ahead and diagnose you with gestational diabetes now. Therefore we don't have to worry about going through so much later on, and just start treating you now because your sugars are starting to go up. So I have been diagnosed with gestational diabetes. I will find out my course of treatment when I go to my doctor's appointment on Monday. And because she called my doctor and they're working together on the treatment plan for me that will help with my sugars. So, alright ladies, I'm going to go ahead and post this video because it's 15 minutes long. And a collage videos over time is only going to make it like 30 minutes long. And I know y'all see so many of my videos that are 30 minutes long that it's just ridiculous. So I'm gonna try to cut my videos down, but it's just so much that goes into my appointments is because I have my health issues, and you know, it's just so much. So I'm gonna just keep it this way, and my next video that you will see from me will be on May the 19th. And that's gonna have my appointment for Monday. It's gonna have my appointment for her echocardiogram information in there, and it's going to have my ultrasound from maternal fetal medicine. So that will be 26 weeks and 1 day. So that will be my next video. So y'all did get a chance to be graced with my beautiful face and messed up ponytail. I have to go get dressed for my spa day with my mom, my best friend. Hands and get my nails and my feet done, and probably going out to lunch and everything, and probably pick out. I think I'm gonna get her swing today. Well, that's my best friend calling. Alright, ladies. I love y'all. Thank you so much. Bye.